Your doctor just scheduled you for a routine screening. You didn't question it. You never do. But what I'm about to tell you might change that forever. Because after 30 years of practicing internal medicine and geriatric health, I can tell you this with absolute certainty. Some of the tests your doctor orders after age 70 are more likely to hurt you than to help you. And most doctors won't say that out loud. I'm Dr. James Harove. I've spent my entire career helping patients over 60 navigate the most confusing part of medicine, knowing when to act and when to leave things alone. And today I need to share something that goes against everything you've been told about preventive care. There are 5 routine medical checkups that I would never get after the age of 70. Not because I don't believe in medicine, I do, but because I've seen what happens when these tests find something in a 75 or 80-year-old body, and it's not what you'd expect. Before I walk you through each one, you need to understand something that changes everything. It's called the screening math, and it shifts dramatically after 70. When you're 50, screening makes perfect sense. You find a small cancer, you treat it early, you have 30 or 40 years of life ahead of you, the math works. But after 70, 3 things change. First, many cancers and abnormalities grow so slowly that they will never cause symptoms in your remaining lifetime. You would die with them, not from them. Second, your body becomes more fragile. The biopsies, the surgeries, the anesthesia, the recovery, all of it carries higher risk. And third, there's something called the cascade effect. One abnormal finding on a routine test triggers a follow-up test, which triggers a biopsy, which triggers a surgery, which triggers a complication. I've watched this cascade destroy the quality of life of patients who walked into my office feeling perfectly fine. That's not preventive care, that's harm. Now, let me tell you about the 5 tests. Number 1, routine colonoscopy after age 75. I had a patient named Margaret, 78 years old, from outside of Philadelphia, sharp as a tack, walked 2 miles every morning. Her previous doctor insisted she needed a colonoscopy because she hadn't had one in 6 years. Margaret didn't want it. She felt fine, but she trusted her doctor, so she went. The bowel prep alone nearly put her in the hospital. She became severely dehydrated. Her potassium dropped dangerously low. Her heart started beating irregularly. She ended up in the emergency room before the procedure even happened. And here's the thing, the USPSTF, the United States Preventive Services Task Force, recommends against routine colonoscopy screening after age 75 for average risk adults. The data is clear. After 75, the risks of bowel perforation, dangerous sedation reactions, and severe dehydration from the prep begin to outweigh the chance of finding a cancer that would actually affect your life. A colonoscopy perforates the bowel in roughly 1 in every 500 procedures. That might sound small, but in a fragile 78-year-old, a bowel perforation can mean emergency surgery, a colostomy bag, weeks in the hospital, and sometimes death. If you're over 75 with no symptoms, no family history, and previous clean colonoscopies, talk to your doctor about whether a simple annual stool test might be a safer alternative. Number 2, aggressive breast and prostate cancer screening. This one is going to be controversial, so let me be very precise. I'm not saying never screen for cancer. I'm saying that aggressive screening in your late 70s and 80s leads to overdiagnosis, and overdiagnosis leads to overt-treatment. Here's what that means. Studies in the New England Journal of Medicine have shown that up to 40% of breast cancers detected by mammography in women over 70 are cancers that would never have caused symptoms or death. They're slow growing, they're indolent. But the moment a doctor sees the word cancer on a report, the machine starts moving. Biopsy, surgery, radiation, chemotherapy, each one with side effects that can devastate an older body. The same is true for prostate cancer. The PSA test is particularly problematic. Elevated PSA levels are incredibly common in older men, and most of the time they mean nothing dangerous. But an elevated PSA leads to a biopsy. Prostate biopsies cause infection in roughly 5% of cases, sometimes requiring hospitalization. And if they find a slow-growing cancer, which they often do, you're suddenly facing surgery or radiation that can leave you incontinent and impotent for the rest of your life for a cancer that likely never would have bothered you. I had a patient, Gerald, 81 years old, a retired teacher from Baltimore. His PSA was slightly elevated at a routine visit. His doctor ordered a biopsy. They found a low-grade prostate cancer. Gerald's urologist recommended surgery. Gerald went through with it. 6 months later, he was wearing adult diapers and told me he wished he'd never taken that PSA test. His cancer was the kind that a man his age would almost certainly have died with, not from. If you're over 75, ask your doctor this. If this screening finds something, what would we actually do about it? And would that treatment improve my life or just extend my anxiety? Number 3, routine cardiac stress testing. This is the one that worries me the most because it sounds so reasonable. Your doctor says, let's just check how your heart is doing. You get on a treadmill or they inject you with a chemical that simulates exercise. Sounds harmless, right? The problem is false positives. Cardiac stress tests in people without symptoms have a false positive rate of up to 40% in some populations. That means nearly half the time the test says something might be wrong when nothing actually is. But that false alarm triggers a cardiac catheterization where they thread a tube through your groin or wrist into your heart. That procedure carries real risks: bleeding, blood vessel damage, in rare cases, heart attack or stroke during the procedure itself. And if the catheterization shows a partial blockage, which is extremely common in anyone over 70, you might end up with a stent. And multiple large studies, including the famous Esquia trial, have shown that stances in patients with stable heart disease do not reduce heart attacks or extend life compared to medication alone. So you've gone from feeling fine to a stress test to a catheterization to a stent to blood thinners with bleeding risks, and you are statistically no better off than if you'd just taken your medication and gone for a walk. If you have no chest pain, no shortness of breath, and no symptoms, a routine stress test is looking for trouble. And in medicine, when you go looking for trouble in a 75-year-old, you almost always find it. Number 4, routine bone density scans. Now, I know what you're thinking, but Dr. James, osteoporosis is a real problem. Falls killer adults. You're absolutely right. Falls are devastating. But here's where the logic breaks down. For preventing fractures in older adults isn't a pill. It's fall prevention, balance exercises, removing throw rugs, installing grab bars, checking your vision, reviewing medications that cause dizziness. These simple steps reduce fracture risk more effectively than any medication without a single side effect. If you've already had a DEXA scan and you're on medication, don't stop it without talking to your doctor. But if your doctor is suggesting a routine DEXA scan and you've never broken a bone, ask whether a fall prevention program might be a better investment of your time and energy. Number 5, routine carotid artery ultrasound screening. This is the test that sounds the most logical and maybe the most dangerous. Your doctor puts an ultrasound probe on your neck and checks for blockages in the arteries that supply blood to your brain. They find a 60 or 70% blockage. Sounds scary, right? Your doctor refers you to a vascular surgeon, and now you're facing carotid endarterectomy, a surgery to clean out that blockage. Here's the problem. You have the right to say, not right now. You have the right to say, no. Your body, your choice, your life. If this helped you see your healthcare differently, subscribe to this channel. I make videos like this every week to help you make informed decisions about your health after 60. And leave a comment below. Tell me, have you ever had a screening that led to more problems than it solved? I read every single comment, and your story might help someone else make a better decision. I'll see you in the next one.